Good afternoon, and thank you, Legislator Szilagyi, for the invitation. I'm going to begin with Assemblywoman Szilagyi and greetings to all of our legislators, Legislator Abrahams, Legislator Bino, Legislator Curran in the back. And I'm going to begin my first few seconds about how I got into public health, because I think it ties into the topic that we're discussing here really well. I trained as an infectious disease specialist and chose to be an HIV doctor back in my days as a practitioner, and it became very clear to me as I got to know my patients over the years, the various factors which impacted STDs and HIV as a disease, and this was back when many people died of it and it was a heartbreaking disease. It wasn't as simple as just go to the doctor and all will be okay. The social determinants of health, housing, economics, job availability, transportation, were very evident as I dealt with a chronic disease that was likely to kill people when I started teaching. And so it gave me an interest. When I became a physician, being a public health practitioner was not what I was thinking of. I was enjoying being an infectious disease specialist, but by nature as an HIV doctor, that kind of brought me together. And at the time, then Commissioner Carney of the Health Department, Dr. Carney, called me and said, I need a physician to sit on the Ryan White Planning Council. It's all voluntary, it's a lot of work, you gotta review bids, but it brings millions of dollars to our social service agencies on Long Island. And I did it, and I got to know her. And then she hired me as her deputy commissioner, which has allowed me to advance my work regarding public health, and I got a master's degree in public health. And one thing that became very evident is all of those problems that we witnessed as HIV specializing doctors persist in the entire public health world. Every year, the University of Wisconsin comes out with rankings of health, and I'm very proud and happy to say that Nassau is always, well, now this year we were basically #1 in all of New York State out of 63 counties. And that's great for me to be able to stand up and say that, but, no, I appreciate it, but never do we forget that that same high level of health does not apply to every community within this county. And so I consider it my #1 and foremost role to try and impact health disparities. When I first came to the health department, we did an 80 or 90-page application to the CDC for a very large multi-million-dollar community transformation grant. It was single-spaced, 80-so pages. It took us months to do. And we got a correspondence from the CDC that said, this application is flawless. It's maybe the best application, but quite frankly, Nassau County is too healthy. You just don't need the money. And it became very evident to me that if I was going to be successful at my job, the job is to impact health disparities, to find out why and how we can try and help the people who are not achieving the same health outcomes as others. And the fact is, in a lot of ways, as we've done the research, it is based on racial and socioeconomic lines. We have now identified 9 zip codes that we call select communities where health outcomes are worse than the rest. In the rest of those zip codes in Nassau County, the health outcomes are way better than the rest of the state. In those 9 zip codes, they are worse than the others, and very often, in many cases, worse than the averages of New York State. And so now when we apply for grants, we apply for those community transformation grants representing those 9 communities, or one of those communities. They're not all African American communities predominantly, many of them are, but they all share certain features of social determinants of health that we need to improve. And so maybe the thing that I've been most proud of is when we sat with my executive staff years back and I said, how are we going to impact this? The very first thing that became evident is while we have, I've always had a lot of initiatives that help and work to impact underserved, at-risk, or minority communities, we didn't have a program. And so the first major move that we did that I'm very proud of is I met with my director at the time of STD services, who I had known because I was an STD physician, and that's Carolyn McCummings sitting in the front row. She had been the Nassau County Department of Health, oh yes, director of STD services for a lot of years, but we chatted and we said, how are we going to impact this? And she went back and got a master's degree in public health as I did. She's now in the final leg of her PhD in public health. Yeah. So soon to be Dr. McCummings, we created together, formalized a Bureau of Minority Health Affairs. And her work has been spectacular in now being able to do not just impacting the STD and HIV unit, but impacting all of the social determinants of health. You have seen her all around community events. And since we've made Carolyn the director of Minority Health, we've since even expanded her role, and we call it the Bureau of Social Health Initiatives, of which Minority Health is just one thing. The STD and HIV unit is in there. And Carolyn is one of my senior leaders within the health department. And I'm proud to say that since 2013, the Nassau County Department of Health has won, has won more National Model Practice Awards in public health than the rest of the counties in New York State, including New York City, combined. And Carolyn has authored half of them. And so, these awards don't just happen because we do it. These awards happen because of community partnerships and collaborations. And I'm telling you this history because I'm reaching out and saying we want community partnerships, we want collaborations, we want to win awards with you. With none of these awards we win on our own, and I am going to defer my seat and I will sit in the audience. I'm happy to answer any questions, but I turn it over to Carolyn.
Thank you so much. So yeah, we're doing a lot of work, and I'm going to sit down because I know our 4 minutes is up. I have 2 minutes. Okay, thank you. So part of what I'm doing in my work with my dissertation has to do with the social influences that impact health among African Americans who receive SNAP. So I'm sort of kind of combining social services and healthcare together in my dissertation. And it's so important because one of the things that I see is that when people's basic needs are not met and they're in poverty, you know, healthcare is sort of like the last thing they think about. So if they're not eating, if their housing is not right, and if other basic needs are not met, you know, we're not thinking about healthcare. And I usually tell my staff who think, you know, well, healthcare is supposed to be most important, you know, why are they not going to the doctor about their STD? Because they're thinking about other stuff. You know, so part of what we need to do is bring social services together with healthcare to try to figure out how do we help everyone meet their basic needs so they can begin to think about health. So that's what we're going to be beginning to do. So,
next we have Miss Danielle Dauphin.
Donovan.